It really makes you think, doesn't it? In a place like India, so dynamic, so much progress happening all the time. And yet, when you look at healthcare, I mean, just the basics of access and affordability, so many people are still facing some really big hurdles.
Yeah, it's a striking contrast for sure.
And what's fascinating, at least from what we've been diving into today, is the way these different pieces of the healthcare puzzle are so interconnected. The drugs people need and how much they cost, whether they can even afford any kind of medical care, and then the role technology plays.
Right, it's like this whole ecosystem. You tug on one part and it ripples out and affects everything else.
Exactly. So for our deep dive today, we've got this really interesting collection of articles. They cover a lot of ground, pharmaceutical policies, how health insurance works or doesn't work in India, and then the whole digital health boom that's been happening. And what we want to try and do is unpack those connections, really see how they all tie together. What are the big debates people are having? What are the roadblocks that are stopping progress? And hopefully, can we see any paths towards a healthcare system that actually works for more people?
Absolutely. A system that doesn't leave people in financial ruin just because they get sick.
Right, exactly. Okay, so let's jump right in. Let's start with something everyone's familiar with. Medicine. And, that whole thing about generic versus branded drugs, which can get so confusing.
Yeah, and I think the most startling thing, right off the bat, is the price difference. I mean, we're talking huge discrepancies here.
Oh, absolutely.
Generic drugs, we're talking 30%, sometimes even up to 90% cheaper than the branded versions. And, India is a global powerhouse when it comes to making these generics. But here's the thing that really struck me. Branded drugs are still holding on to a big chunk of the market share in India.
It is kind of perplexing, right? You'd think with that kind of price advantage, generics would be flying off the shelves, but it seems like a major obstacle is just perception. There's this idea out there that if it's cheaper, it can't be as good. This whole you get what you pay for mentality. But the thing is, scientifically speaking, generics are what they call bioequivalent.
And that's key. Bioequivalent, meaning it's the same active ingredients, the same dosage, the same safety standards. It's designed to have the exact same effect on your body.
Right. The science backs it up. They're essentially the same thing. But this trust issue that's real, people have deeply ingrained beliefs about brands and quality.
And to add to that, there's something that came up in our research that I found pretty unsettling, frankly. It seems a lot of doctors still default to prescribing the branded medications. And the reasons behind that, well, let's just say it suggests a level of influence from the pharmaceutical companies that raises some ethical questions.
It does make you wonder, what factors are really driving those decisions. You would hope it's always about what's best for the patient, not about any kind of financial incentives or pressure from the industry.
Ideally, yes, but the reality is often more complicated.
It's not that India's lacking in regulations either. I mean, when it comes to approving generic drugs, they have pretty strict standards from what I understand.
That's true, the regulations are there. The problem, as highlighted in the articles we've been looking at, seems to be more about enforcement, making sure those quality controls are applied consistently across the board.
Consistency, that seems to be a recurring theme.
Yeah, and when you zoom out and look at the bigger picture, the whole political and regulatory landscape, it's like this constant push and pull. The central government, they're often pushing for more use of generics. They see it as a way to bring down healthcare costs overall. Makes sense, right?
Absolutely.
But then you have resistance at the state level. Local groups, healthcare providers, sometimes they push back. And then, of course, you have the pharmaceutical industry itself. They've got a lot of money, a lot of lobbying power, and they definitely play a role in shaping policy.
It's a constant negotiation, isn't it? Trying to balance affordability against these entrenched market forces. And speaking of the government's efforts, these Jan Aushadhi Kendras, these government-run pharmacies that specifically sell generic drugs, that seems like a great initiative.
In theory, absolutely.
But what we saw in the article suggests they're facing quite a bit of resistance, particularly from the private pharmacies, the distributors. They have a vested interest in selling the branded drugs, right? That's where the bigger profits are.
Yeah, it's all about the bottom line for them. And you can't really blame them for trying to protect their business, but it does create a tough environment for something like the Jan Aushadhi Kendras to really take off.
Right. And then there's this whole other layer of complexity with India's policy on compulsory licensing. This is where the government can basically say, look, we need to make this life-saving drug accessible, so we're authorizing the production of a generic version, even though it's still under patent. And as you can imagine, the big multinational pharmaceutical companies, they are not happy about that.
Understandably, they see it as a threat to their intellectual property. But from a public health perspective, it can be a really vital tool.
Absolutely. It's about finding that balance again. And even with regulatory bodies like the NPPA, the National Pharmaceutical Pricing Authority, trying to keep drug prices in check, it seems like there are still loopholes. The companies find ways to work around the rules, keep those prices high.
It's like a constant cat and mouse game.
So where do we go from here? What are some potential solutions? It feels like there's no easy fix.
Yeah, it's going to take a multi-pronged approach for sure. What a lot of these articles are suggesting is, first and foremost, more political consensus. Can we get everyone on the same page, at least to some degree, and prioritize public health over partisan politics? One idea that keeps coming up is mandating generic prescriptions.
Interesting. So the doctor would have to prescribe the generic version first.
Right. The branded option could still be available, but it wouldn't be the automatic default. Of course, to get something like that passed, you'd need a lot of political will. There would be pushback.
I can imagine. What else?
Okay, so we've got to strengthen those Jan Aushadhi Kendras, make sure they have reliable supplies of the medicines people need. Public awareness campaigns could also help build up trust, let people know that these generics are just as good.
And it can't just be a government effort, right? It feels like bringing in the private sector could make a big difference. Maybe some kind of public-private partnership to ramp up production of quality generics.
Exactly. And something I think is crucial is more transparency around drug pricing. How are these prices actually being determined? That would help level the playing field, prevent some of that manipulation we've talked about.
Right, bring some sunlight into that whole process. And then, of course, education for both doctors and patients. Everyone needs clear, unbiased information about numerics so they can make informed decisions.
Totally agree. So if we take a step back and think about the big picture, the potential benefits here are huge. Lower healthcare costs, that's a game changer for so many families, especially those dealing with chronic illnesses. A strong generic drug industry that's good for the economy, less reliance on imports. And then better access to medicines, especially in rural areas, that could really improve people's lives. It's about building a healthcare system that's sustainable and equitable for the long haul.
Okay, so we've talked about medicine. Now let's shift gears and talk about another piece of the puzzle that can make or break people's financial well-being, health insurance.
Yeah, because even if you bring down the cost of drugs, you still have all those other expenses, doctor visits, hospital stays, procedures, and those costs could be crippling.
Absolutely. And the numbers on this in India are kind of shocking. I mean, think about this. About 63% of healthcare spending in India is out of pocket. That's people paying directly with their own money.
Wow.
And yet, only about 35 to 40% of the population actually has health insurance. So you've got this huge portion of people who are incredibly vulnerable. If a medical emergency hits, it could wipe them out financially.
It's a recipe for disaster. And it makes you wonder, why is there such a gap? Why aren't more people getting insured when the need is so clearly there?
Right. It seems like there are a few things going on. One is just a lack of awareness. People don't really understand how insurance works, what the benefits are. There's also a trust issue. Will the insurance company actually pay out when I need them to? Are there hidden gotchas in the fine print?
And then, of course, there's the cost. Private insurance, especially for middle-income families, it can be incredibly expensive. Even with government schemes like Ayushman Card, a lot of people are still priced out.
And it's not just about having some kind of coverage, is it? It's about the quality of that coverage. What does it actually include? Because what we saw in a lot of these articles is that many policies don't cover things like routine checkups, those outpatient expenses that can really add up over time.
Right, and they often have limited coverage for chronic illnesses or pre-existing conditions. So the people who need comprehensive protection the most, they're often the ones who are left with the biggest gaps in their coverage.
Exactly. It's those details that can make all the difference. And when we look at the policies and regulations around health insurance, we start to see some familiar patterns. The state governments have their policies, the central government has its own approach, and it doesn't always mesh seamlessly.
Yeah, all that fragmentation makes it really hard to build a cohesive system that works for everyone. And even with the IRDAI, the Insurance Regulatory and Development Authority of India, working to oversee things, there's still a lot of variation across different insurance providers. It's not as standardized as it could be.
And the growth of private insurance, while it does offer more options, it also creates the need for stronger oversight. We need to make sure they're not taking advantage of people with super high premiums or unfair exclusions.
Absolutely. Robust regulations are essential. And then you bring in politics and things get even more complicated.
Oh, for sure. We saw a few articles that talked about the challenges of rolling out these big national programs like Ayushman Bharat. Sometimes it's because of pushback from states that are run by a different political party than the central government.
Yeah, it becomes a political football. And then there are issues with fraud and mismanagement, both in public and private schemes, which undermines trust and ends up driving up costs for everyone.
Right, it's this vicious cycle. So when we think about solutions, it seems like, again, it's going to take a multifaceted approach. And a lot of the experts in these articles are saying that cross-party collaboration is essential. Can we get everyone to agree on a shared vision for universal health coverage, maybe by finding ways to integrate those existing state and central schemes?
A unified approach would be a game changer. And then regulatory reforms are crucial. Things like putting caps on how much premiums can increase, standardizing the whole claims process, giving people more protections.
Right, make it all more transparent and consumer friendly. And I think public-private partnerships could play a role too, bring in the expertise and resources of the private sector, but with clear accountability built in.
Absolutely. Accountability is key. And we can't forget about the middle class. A lot of them don't qualify for government assistance, but they're still struggling to afford private insurance. Maybe some targeted subsidies could help bridge that gap.
Yeah, make it a little more accessible. And then, of course, there's that education piece again. Public awareness campaigns are vital. Help people understand how insurance works, why it's important, and build trust in the system.
It's about empowering people to make informed decisions. So when we think about the impact of a stronger health insurance system, it's huge. Reduced out-of-pocket expenses, that's a lifeline for so many families. Better access to health care, especially for the most vulnerable, that leads to better health outcomes overall. And a healthier population is a more productive population. It's about creating a healthcare system that's both sustainable and fair.
Okay, so we've covered medicines, we've talked about health insurance, and now let's turn our attention to the third piece of the puzzle that's been getting so much buzz lately, telemedicine and this whole digital health revolution.
Yeah, this is an area that's really exploded, especially since the pandemic. It's been amazing to see how quickly people have adopted these digital tools.
It really has, and the potential is enormous, but what these articles also highlight is that there are some real challenges that need to be addressed.
Oh, absolutely. And I think the biggest one that keeps coming up is unequal access. Not everyone has the same opportunities to benefit from these advancements.
Right. The digital divide, we've heard about it in other contexts, but it's playing out in healthcare in a big way.
Exactly. So you have these incredible digital platforms, apps, that can connect you with doctors remotely, get prescriptions filled, manage your health data, all kinds of things. But if people don't have reliable internet access, or if they don't have the skills to use these technologies effectively, then those benefits are basically out of reach.
It's like having a state-of-the-art hospital, but you can't get through the door.
Yeah, a perfect analogy. And it really underscores the point that all three of these areas we've been discussing, generic drugs, health insurance, medicine, they're all interconnected.
Right, they all feed into each other.
So think about it this way. If people can't afford basic medications because they're stuck with the expensive branded versions, then that limits their ability to access healthcare in general, whether it's in person or through telemedicine. And then if they don't have health insurance or their coverage is inadequate, then the cost of teleconsultations, even if they're cheaper than in-person visits, can still be a barrier.
And it doesn't matter how great the technology is, if people aren't equipped to use it, that digital literacy piece is huge.
Totally. And then you add in the political dimension, and it gets even more complex. What struck me as I was reading through these articles is how often they point to the lack of consistent collaboration as a major obstacle. It's like different parts of the system are working in silos instead of working together towards a common goal.
Yeah, it's that lack of a unified vision that seems to be holding things back.
Exactly. And the experts are pretty clear about this. They're saying we need a fundamental shift. We need leaders who are willing to put public health above partisan interests and work together to create a healthcare system that truly serves the needs of the people.
So as we wrap up our deep dive today, let's just take a moment to recap some of the key takeaways. We started by looking at this whole issue of branded versus generic drugs. And what stood out is how much perception, incentives, and even the way regulations are or aren't enforced all play a role in keeping those costs high.
Right, and how that impacts people's access to essential medicines.
Then we move on to health insurance, and the big takeaway there is just how many people in India are still uninsured, leaving them extremely vulnerable to financial hardship if they get sick. And a lot of that comes down to affordability, lack of trust in the system, and policies that just don't cover enough.
And then we finish by looking at the potential of telemedicine, which is huge, but also at the digital divide that's preventing a lot of people from actually benefiting from it.
Right, and I think the overarching theme here, the thing that ties it all together, is that we need a more holistic approach. We need to recognize that all of these pieces of the healthcare puzzle are interconnected, and we need a system that addresses them in a coordinated way.
Absolutely. It's not enough to just focus on one area in isolation. It's got to be a comprehensive effort.
And it's got to be driven by a genuine commitment to public health, not by political maneuvering or special interests.
I completely agree.
So as we leave you today, I think the question that we're all left with is, where do we go from here? What can each of us do, even in the face of such complex challenges, to push for a more equitable and sustainable healthcare system? And which of these issues, the cost of medicine, the lack of insurance, the digital divide, which one resonates most strongly with you and why? It's something to really think about.
It really is.
And I hope this deep dive has given you some food for thought and maybe even some inspiration to get involved.
Me too. It's been a great discussion.
Thanks for joining us today.
Thanks for having me.